Most people over 50 have felt it at some point. That heavy, dragging tiredness that just won't go away no matter how much you sleep. The cold hands that never really warm up. The headaches that keep coming back. The feeling that something is off, but you can't quite put your finger on what. And here's what happens almost every time. People brush it off. They tell themselves it's just age. They tell themselves they're just stressed, or not sleeping well, or not eating right. And because these symptoms don't come with pain or a visible sign, they get ignored for months, sometimes years. But what if your body isn't just tired? What if it's been sending you messages you haven't recognized yet? Today we're talking about iron deficiency, not anemia in its full-blown stage, but the early, quiet version that millions of Americans over 50 are living with right now without knowing it. This video covers 10 warning signs that your body may be running low on iron. Some of them are obvious, some of them will surprise you. And the last one on the list? It's the one most people dismiss completely, even though it can be one of the most telling signs of all. Stay with me through this entire video. At the end, I'll tell you exactly when these symptoms mean it's time to stop guessing and talk to a doctor. One important note before we start. Iron deficiency is not something you should try to diagnose yourself. Many of these symptoms can be caused by other conditions. This video is not medical advice. It's information to help you understand your body better and have a more informed conversation with your doctor. If any of these symptoms sound familiar, please get checked out. That's the whole point. Before we get into the list, I want to hear from you. Tell me in the comments where you're watching from and which symptom worries you the most. I read every comment, and your responses help me know what topics matter most to you. Number 1. Fatigue that doesn't make sense. This is the most common sign of iron deficiency, but it's also the easiest one to explain away. And that's exactly why so many people miss it. We're not talking about the normal kind of tired you feel after a long day. We're talking about a tiredness that settles in deep, that doesn't lift after a good night's sleep, that makes basic things feel harder than they should. Getting up from a chair, climbing the stairs, finishing a conversation without feeling mentally drained. Iron is what your body uses to make hemoglobin, the protein inside red blood cells that carries oxygen through your bloodstream. When iron drops, the blood carries less oxygen. And when the blood carries less oxygen, everything in your body has to work harder to keep running. That includes your muscles, that includes your brain, that includes your heart. The reason people over 50 often miss this sign is that fatigue feels expected at this age. The culture around aging has taught us that slowing down is natural, that getting tired faster is just part of the deal. And sometimes that's true. But when fatigue is persistent, when it's there most days, and it doesn't have a clear reason, it deserves a closer look. If you've been exhausted for weeks or months and you're not sure why, this is worth mentioning to a doctor. A simple blood test can check your iron and ferritin levels. Ferritin is what measures your iron stores, meaning how much your body has in reserve. You can have iron deficiency even when your anemia markers look normal. That's something many people don't know. Number 2. Pale or yellowish skin. Your skin color can tell you things about what's happening inside your body. Most people know that in theory, but in practice, they don't look closely enough. When iron levels drop, the red blood cells that carry hemoglobin become fewer and smaller. That reduction in hemoglobin is what gives skin, gums, and the inner lining of the eyelids their color. When those levels fall, skin can start to look washed out, pale, or in some people slightly yellowish. One way to check this yourself is to gently pull down your lower eyelid and look at the inner rim. In people with healthy iron levels, that inner lining is a deep pink or red. When iron is low, it can look pale pink or even white. The problem is that skin tone changes happen gradually. You don't see it happening day by day. By the time someone notices, the deficiency has usually been building for a while. And people living alone are especially likely to miss it, because there's no one looking at them closely enough to notice the change. If someone tells you that you look pale, or if you notice it yourself in photos, don't dismiss it. It may seem like a cosmetic observation, but it can be a meaningful physical signal worth investigating. Number 3. Shortness of breath during normal activities. This one catches people off guard because they don't connect it to iron. They assume shortness of breath is a heart issue, or a lung issue, or just being out of shape. And sometimes it is those things. But low iron is also a real and overlooked cause. Here's how it works. When iron is low, hemoglobin drops. When hemoglobin drops, the blood can't carry enough oxygen to keep up with what your body demands, even during light activity. So your lungs start working harder to pull in more air, trying to compensate for the shortage. What does this look like in daily life? It might mean you get a little breathless walking from the parking lot to the store. It might mean climbing one flight of stairs leaves you needing a moment to recover. It might mean you find yourself breathing harder than expected during tasks that never used to bother you before. Many people over 50 interpret this as cardiovascular decline and leave it at that. But if your heart has been checked and things look okay, and you're still getting winded more than you used to, ask your doctor specifically about your iron and ferritin levels. The fix for one of these is very different from the fix for the other, and you deserve to know which one you're dealing with. Number 4. Heart palpitations. Feeling your heart beating faster or harder than normal, especially when you're not doing anything strenuous, can be unsettling. And understandably, most people's first instinct is to worry about their heart. But heart palpitations can also be a response to low iron. When the blood isn't carrying enough oxygen, the heart compensates by pumping harder and faster, trying to circulate more blood to make up for the reduced oxygen in each beat. The result can feel like a racing pulse, a pounding sensation in the chest, or an irregular heartbeat. This doesn't mean every palpitation is caused by iron deficiency. Heart rhythm problems are serious and always need medical evaluation. But if you've had your heart checked and the results don't fully explain what you're feeling, iron should be part of the conversation with your doctor. People over 50 are often on multiple medications, which can complicate the picture. That's all the more reason to get a thorough blood panel and not just assume the cause. Number 5. Headaches and dizziness. Frequent headaches and occasional dizziness can have dozens of causes. Dehydration, blood pressure changes, poor sleep, eye strain, tension. But when these symptoms are happening often and you can't pin down a clear reason, low iron is something worth considering. When the brain doesn't receive adequate oxygen through the blood, it responds with pain. The blood vessels in the head can dilate to try to increase blood flow, and that dilation is what triggers the headache. Some people describe this kind of headache as a dull pressure at the front of the head or behind the eyes, one that tends to come back in the afternoon or after exertion. The dizziness that comes with iron deficiency is usually a light-headed, floaty feeling, rather than the spinning sensation associated with inner ear problems. It tends to come on when you stand up quickly or when you've been on your feet for a while. People tend to treat these symptoms one at a time, reaching for a pain reliever for the headache or sitting down until the dizziness passes. That's understandable. But when these symptoms keep cycling back, they may be signals pointing towards something that needs to be addressed at the root level, not just managed episode by episode. Number 6. Cold hands and feet. This one doesn't get talked about enough, probably because it feels minor. But persistently cold hands and cold feet, even in warm environments, can be a sign that circulation isn't delivering enough oxygenated blood to the extremities. Iron deficiency can impair circulation in this way. When hemoglobin is low and the blood isn't efficiently carrying oxygen, the body prioritizes the organs at the center. The hands and feet, being furthest from the heart, are the first to feel the effect. They can feel chronically cold, sometimes even a little numb or tingly. For people over 50, this often gets blamed on age-related circulation changes, which are real. But that doesn't mean iron deficiency isn't also playing a role. If you've always been someone who runs warm, and this is a recent change, pay attention to it. If it's combined with other symptoms on this list, it's worth bringing to your doctor's attention. Number 7. Brittle nails and hair loss. Your nails and hair are not just cosmetic details. They're indicators of what's happening in your body's supply lines, the nutrients, proteins and minerals that feed the cells responsible for growth. Iron is one of the nutrients the body will divert away from hair follicles and nail beds when it's running low, because it prioritizes organs and vital functions first. The result can be nails that chip easily, crack along the edges or develop ridges, It can also mean hair that comes out in larger amounts when you brush it, or that looks thinner over time. One specific nail sign associated with iron deficiency is called koilonychia, or spoon nails. This is when the nails start to curve upward at the edges, forming a slightly concave shape instead of the normal convex curve. Not everyone with low iron develops this, but when it appears, it's a fairly specific indicator. Hair loss is harder to evaluate because it has so many potential causes, including thyroid issues, hormonal changes, nutritional deficiencies, and stress. But if you're also experiencing other symptoms from this list along with noticeable hair thinning, iron is one of the first things that should be checked. Number 8. Difficulty concentrating and brain fog. This one tends to get dismissed as a normal part of aging, more than almost any other symptom on this list. But while some degree of cognitive slowing does come with age, persistent brain fog and difficulty thinking clearly are not just inevitable facts of life that you have to accept. Iron plays a role in how well the brain functions. The brain is a high oxygen organ. It consumes roughly 20% of the body's oxygen supply even when you're just sitting still. When iron drops and the blood carries less oxygen, the brain is one of the first places to feel the shortage. People describe this as thinking through fog, forgetting words mid-sentence, reading the same paragraph 3 times without absorbing it, losing track of what they walked into a room to do, feeling mentally slow in a way that is distinct from regular tiredness. The reason this matters so much is that cognitive symptoms can significantly affect daily life and quality of life, and when they're caused by something correctable like iron deficiency, addressing the underlying issue can make a real difference. Assuming these symptoms are just age, and not investigating further, means missing an opportunity to feel meaningfully better. Number 9. Restless legs. Restless legs syndrome is a condition where you feel an uncomfortable urge to move your legs, usually in the evening or at night when you're trying to rest. It can feel like a crawling, tingling, or aching sensation inside the legs that only eases when you move them. For people who have it, it makes relaxing and falling asleep very difficult. Restless leg syndrome has multiple possible causes, but one of the well-recognized associations is iron deficiency. Researchers believe this connection involves the way iron affects dopamine processing in the brain, and dopamine is involved in controlling movement. When iron is low, that system can get disrupted, and the restless leg sensation can intensify. What makes this especially frustrating is that restless legs often shows up most at night, so it gets lumped in with general sleep trouble rather than being recognized as a separate symptom with its own cause. People take sleep aids or simply suffer through it, not knowing that their iron levels could be part of the explanation. If you have restless legs and have never had your ferritin checked specifically, ask about it. Ferritin, again, measures stored iron, and it can be low even when other blood markers look normal. Your doctor will need that specific